We know that there's a lot of mobility of healthcare workers across the world, and anybody that is working with them wants to have some sense of what are their capabilities. So this concept of credentials verification, having some way of verifying what their educational experience has been, but increasingly their work experience, the type of work that they've done, is becoming more and more of a global issue. Probably one of the more exciting events of the last, really 10 to 15 years now has been the rise of what's called outcomes-based medical education. And that actually is occurring at the medical school level through what we call postgraduate medical education, and now into continuous professional development. So as we think about the kind of continuum of a health profession's career, particularly physicians, is my background. This idea of always striving for better outcomes that are particularly tied to better outcomes for patients, families, and communities, I think is huge. Then the question becomes, so how do we do that? And that's where this concept of the competency-based medical education, or competencies by defining the abilities health professions need, is something that has now become really a global phenomenon. So I think these type of efforts are incredibly important because we need to learn from each other across borders, right? We're all struggling with various healthcare issues. That's not unique to any given country. We're all striving to provide the best healthcare we can, and in order to do that, we have to have educational practices and credentialing practices that enable that. And the more that we can share those best practices, lessons learned, then I think we're all better off, and I appreciate the Commission doing that so that we can all learn together.